It's the Real News Network. I'm Sharmini Pires coming to you from Baltimore. The Speaker of the California Assembly, Anthony Rendon, announced last Friday that he is shelving Healthy California Act for the rest of the legislative period. The act is a single-payer healthcare law, which the California Senate already passed. If the pending bill is passed through the legislature, California would become the first state to guarantee health care to all of its citizens. Speaker Rendon, a Democrat, argued that the law in its current form is woefully incomplete, he said. Governor Jerry Brown, who supported single-payer health care when he ran for president in 1992, also opposed the bill. The California Nurses Association, which had spearheaded the law, expressed outrage that it was shelved. Senator Bernie Sanders also tweeted last Friday, calling on Democrats and Speaker of the California Assembly to reverse his decision and let the bill proceed to a vote. Joining us today to discuss the Healthy California Act and its fate is Bonnie Castillo. She is a registered nurse and director of the Registered Nurse Response Network. She's also served as the Government Relations Director for the California Nurses Association. Good to have you with us, Bonnie.
Nice to be here. Thank you.
So, Bonnie, the California Senate already passed this bill, but as I said, Governor Brown is not very supportive of the bill at this moment. So give us a sense of what's going on politically there. What's in the bill? Why did Rendon stop it from proceeding on the floor? And, of course, why Governor Brown is opposed to it?
Well, I think you said it. This is politics instead of leadership. We had a very full and active debate and discussion in the Senate, and we had hearings that were packed, seriously packed in the Senate Health. Hundreds of folks came to the initial hearing, and we heard from all of them. And it passed, as you said, it passed the Senate overwhelmingly. And as we were proceeding to the Assembly, we waiting for, it was in the Rules Committee where it gets assigned. And we were waiting for the assignment. Typically, that would have been the Assembly Health Committee. And instead, on Friday, this past Friday, late, about 4:45, we heard not from the Speaker, right? Not from the Speaker the day before, half hour before, anytime. We heard from the press that Speaker Rendon had decided himself in a very czar-like fashion that he was going to hold the bill and that he was recommending this based that it was incomplete. Now that, for us, is just it is a derelict. It's a derelict action based on what we're hearing is that he's essentially saying that it was an incomplete bill, and that's simply not the truth. The fact of the matter is we have, as I said, we had a very good discussion and went through the Senate, and actually the issue of financing, we commissioned a study. We wouldn't have commissioned a study that wasn't peer-reviewed or scholarly. We have a very an excellent scholarly study that examines and provides mechanisms for financing, and yet when we were ready to go through the Assembly process with the people, because we do have a majority of Californians that are looking for relief, looking for leadership so that we can have guaranteed health care for every single Californian, he ripped that process away from them. And that's not a leader. That's clearly, it resembles what has happened at the federal level, where, it was secretive. As I said before, we are the sponsors of this bill. We weren't even notified. And so we are responding. And it is, he claims to be people have said he's protecting the legislature. What we know is he's not protecting anyone in California. And in fact, he's abandoned them. And so we are, continuing our actions and pressures today. We're at the state capitol. Yesterday, we were in his district office with hundreds. Within days, hundreds showed up at his district office to do a die-in.
Right. And the California Senate, when they passed this bill, Bonnie, they passed it 23-14. It wasn't like it was on the border and so forth. And then, of course, we have economist Robert Poland, who we've interviewed here before, just after he had made a presentation to the Senate, and argues that this is actually cost efficient for California. And that is one of the issues being raised, at least by the chair of the legislature, Rendon, that the cost issues haven't quite been sorted out, where in fact it has been sorted out. And based on the presentation Robert Poland made, Senate voted in favor of the bill. So what other underlying issues are there that they're not speaking of, which leads both Governor Brown and the chair of the legislature to hold off on passing this bill?
Well, I think you said it. There's faux arguments here with regards to the cost, not taking into consideration the cost that we're already paying and how much we're already spending, and with no checks in terms of the escalating costs and the fact that people are suffering and people are not, as nurses, we see the effects every single day in our workplace. We know that people are not only delaying care, they're not getting any, that by the time we see them, their conditions are so exacerbated because they didn't have care or are delaying care. So in terms of what's underlying this, what we know, is that this is simply, them, and when I say them, certainly the Speaker, Rendon, and basically being beholden to the insurance companies and to the healthcare industry, to those donors that fund their campaigns to get reelected. They're focused on getting reelected and fundraising, and we.
I have to say, Bonnie, in Robert Poland's arguments that he presented, he actually showed through economic statistical analysis that Californians would actually be saving billions of dollars if they go ahead and do this by various preventative care measures and referring people to clinics for health care rather than what they do when they don't have insurance, which is go to emergency. There's various ways in which California can actually save money with the single payer system here. Is that argument even being articulated in the legislature at this time?
Well, that's what we would like to be presenting now, because as registered nurses, we know that continuity of care, especially getting early primary care and getting it as I said, in a continuous manner in terms of addressing illness and injuries when they first occur, that obviously makes sense in terms of dealing with as opposed to waiting until you're very, very ill or not getting any kind of care, preventative care. By the time you show up into the emergency room, what we see is that the patients are in very, very bad condition. So we know as nurses that preventative care and prevention actually does make a huge difference in terms of not only, restoration of health, but really it's economical.
Right. And as I stated in the intro, Senator Bernie Sanders has gotten in on this. And also there is incredible amount of statistics available right now where Democrats and people who voted Democrats for the Democrats actually support single-payer system in this country as well. Therefore, is there any chance that this bill is going to be brought back for consideration as Bernie Sanders is calling for?
Well, they're taking a big political risk. They're actually calculating that this could be done. In fact, they thought that it could be done, without anyone noticing, without anyone caring, and that's actually not the case. We, obviously, there's been a tremendous response and backlash. And calling out of the lack of leadership. This is the speaker of the state of California who essentially refused to give the people their day in the state assembly. This is a real, it is essentially the democratic process has been ripped away from them. And that is not going to stand. This is not, this is not something that he will be able to get away with. Now, as I said, we also are calling out all of the legislators. They have to take a stand. This becomes, which side are you on? Are you on the side of Californians and patients? Are you on the side of the insurance companies and their drive for increasing profits? This is really what it comes down to. There's so many examples of where they have refused to stand up to the insurance companies, to the pharmaceutical companies, to the healthcare industry. Time and time again, they refuse to put any kind of cost control, regulatory measures. They've had many opportunities, and now, what's happening at the national level in terms of the lack of compassion and leadership, this is the time where we in California could set the national example. We could do that, but we need leaders. And what has become very apparent is that these leaders are not standing up. They are not standing up for good policy that actually makes a difference in people's lives. People are really struggling at this time. This is not the time for engaging in this backdoor, obviously, we are profoundly disappointed, but we're angry too. And I think that the people are angry, and this is not going to stand.
All right, Bonnie, I thank you so much, and all the best with your efforts to get this back on the floor of the legislature of California.
All right. Thank you very much.
And thank you for joining us here on the Real News Network.